Many people are left with too much skin after losing a lot of weight, and this morning we're looking into some ways to tighten it up. Let's bring in Dr. Matthew Knight. He is the president of Knight Dermatology Institute. Good morning. It's always good to see you.
Thanks for having me. Great.
So a lot of this is because there are people who are using a lot of these weight loss shots, including Ozempic and others like it, right? So the great thing is you lose all this weight and you're feeling so good about yourself, but then you've got this saggy skin that stays behind.
You know, isn't it wild? I mean, like 700% more people are on these drugs. Something like 20% of all Americans have had some exposure.
It's that high. Wow.
And so it can be transformative for folks that need it because they have metabolic syndrome or morbid obesity, and you give people their life back. But the problem is that there's fat, and then there's fat we want and fat we don't want.
Yeah.
So fat between our organs, visceral fat's really bad, but fat in our face can be really good. That's why babies look cute and have no wrinkles.
We love the little fat on babies, though.
Right.
Yeah.
You know, facial fat is what holds up our skin, and you can't selectively decrease fat. It's like those old ab rollers from the 90s. You can't target fat and lose fat in certain areas. If you're going to lose it one place, you're going to lose it everywhere. And so when you lose it in your face or in parts of your body, it can lead to jowling and sagging of the skin, and it's really unfortunate.
Okay, so what do we do? How do we prevent it?
Well, part of it is that there's a lot of folks that are buying these drugs online, not under a doctor's supervision, and they're taking too much of this stuff. And so just like the way our skin reacts during pregnancy or weightlifting, our skin doesn't react really well acutely. Like, we need time. So if you lose a lot of weight all of a sudden, the skin doesn't contract very well. And that's especially true as we're older because our elastic fibers don't work as great.
Does it matter how quickly you lose the weight?
Yeah, so if you lose the weight really fast, our skin really struggles to recoup and reshape the way it was. And the older we get, the worse it is because our collagen and elastin fibers don't work the same way. And so part one of it is making sure you're under a doctor's supervision and don't overdo it. And that's especially true if you're doing it for a major medical problem, it's one thing. But if you're doing it to lose a couple pounds to get that bikini body, and all of a sudden you notice that your face looks totally different, that can be really disheartening. And so it's important to take the right dose.
Is that what they call Ozempic face? Or is that it?
Right, yeah,
okay,
Ozempic face. And that's the thing, is that our face is held up by fat. And so we go to great lengths to replace volume in people's faces with things like facial fillers, which work but only goes so far. So if you lose a lot of fat in your face, you can't replace it all with filler, or if you try, it's that overdone appearance I'm sure you've seen online. But it's really striking. I'm sure you've seen people that have been on these drugs and you almost don't recognize them because they've lost so much facial fat that they look massively different.
So what can we do to tighten up?
Well, there are some non-surgical things you can do, filler being one of them. Laser and light devices using radio frequency or ultrasound can help tighten the skin.
And Dr. Knight, does the laser work just for the face or all over the body?
Yeah, well, they don't work that great for the face or the body, but primarily these are for your face. The idea is you can heat the skin and cause the skin to contract, but it doesn't address the original problem, which is the loss of fat and substance underneath that holds up our face. And so these things work, but they don't work that great. A lot of people end up needing traditional plastic surgery, like a facelift or a tummy tuck, to address this problem.
I was going to say, it sounds like if those don't work, then you're going to have to resort to surgery to get rid of some of this. Talk about the safety of that and how common that is, especially now, given so many people have lost so much weight using some of these weight loss drugs.
Yeah, I mean, there are a group of folks and a lot of people that have had total transformation of their life.
From like head to toe.
Yeah, they've lost so much weight and they're so much healthier. Their visceral fat is down, their fatty liver has been decreased, they're doing so much better. But they're like, Doc, I've got all this skin in my abdomen and under my arms, and removing that can also change people's lives, make a huge difference. But that is surgery. That means,
how safe is something like that?
Yeah, you got to go to the operating room, have general anesthesia, and if you're having it done with a board-certified plastic surgeon who does this a lot, it can be very safe, but it's still a big procedure, and there's considerable downtime, but it can make a big difference. Of course, if the problem is the weight goes back up, then you've done all that for nothing. But for a lot of people, this can make a huge difference, but it's surgery, and you have to take it seriously.
So what would your advice be as we wrap here for people who do need to lose that really large amount of weight? What would your advice be in terms of maybe even avoiding the surgery at some point? And it sounds like maybe take it slow as you're losing.
Yeah, I mean, I think the biggest thing, and I feel like I say this all the time, but the biggest thing is don't go it alone and make sure you're working with a physician that's going to monitor your progress and make sure you're doing things the right way. You can buy these things online with no supervision. That's not safe because doing it too much, too fast can lead to a lot of downstream problems that are unintended. So make sure you're partnering with a physician that knows what's going on. But, you know, know, a lot of people lose a lot of weight. That's a really great thing. These drugs affect our hunger centers in our brain, and they make us less hungry, and they change the way our body works. It reduces fat, but if you reduce fat in your organs and your liver, which can be great, you're going to reduce fat in the rest of your body and your face, which can be a huge problem for people. And so there are treatment options out there, but you know, if it's a really severe problem, it is time to talk to a board-certified plastic surgeon about your options.
Really good information as always, Dr. Knight. Thank you so much.